Okay, yes, Vandana, we are ready to go.
So good afternoon, everyone. We are extremely sorry for the delay. There was a small technical glitch. Apologies for the same. So without any further delay, let us go on to the session today. I once again welcome you all to another inspiring session of Unsung Heroes today. So we have three panelists from diverse background. So let us begin the session with the introduction of the panelists. So first we have Ms. Kaksha Attar. So she has a diverse background in optometry and is an ocularist. She earned her bachelor's degree in optometry from George College of Management and Science, Kolkata, in 2013. During her internship at Shankar Nethralaya, Kolkata in 2017, she developed a keen interest in ocular prosthesis. So this passion led her to pursue a long-term fellowship in oculoplasty and oculistry at LV Prasad Eye Institute, Hyderabad, where she trained from 2017 to 2019. Following her fellowship, she had an opportunity to serve as a consultant optometrist and ocularist at LV Prasad Eye Institute for 2.5 years. So she then returned to Calcutta with the intention of starting her practice. However, due to the challenges posed by COVID-19 and unfavorable market conditions, she decided to drop the idea. She joined Soham Eye Clinic. It is a renowned clinic in low vision and ocular prosthesis in West Bengal, where she has been working for the past 3 years. So, in addition to her clinical practice, she is actively involved in freelancing activities. She conducts workshops on ocular prosthetics at various colleges and participates in seminars and conferences across Bengal. So she has had the privilege of mentoring international students and faculty in this specialized field. So if we can have her video being played, please. Thank you, Harshada. So moving on to our next panelist, he is Mr. Likhat Jain. He completed his bachelor's in clinical optometry from Bharatiya Vidyapeeth Medical College, School of Optometry, Pune in the year 2022. Currently, he is continuing with his family business named as Jain Opticals with a history of 50 years, and he is the third generation to be handling the same. So he wanted to pursue optometry since his younger days, and he started his optometry clinic in 2023. He specializes in accurate power checkup, soft contact lenses, contact lens fitting, orthoptics evaluation, occupational optometry, and dispensing of frames, lenses, and sunglasses as per the customer requirements. So can we have his video, please, Harshada?
Just 1 second, Spandana. 1 second.
Hey, sure. Thanks, Harshada. We'll move on to our third panelist, Dr. Kiran Kumar Gulve. He has done his bachelor's from D.Y. Patil University, Pune, master's in optometry from NIMS University, Jaipur. He has done a fellowship in orthoptics and vision therapy from Dr. Shroff Eye Hospital and Research Center. He has done his master's in psychology from Acharya Nagarjuna University, Hyderabad. So at present he is a PhD scholar at Om Sterling Global University. He has a proven track record of 10 years plus in delivering personalized care and treatment plans to improve the quality of life for patients with keratoconus, binocular vision problems, issues of autism, ADHD, learning disabilities, and other vision disorders. He has conducted more than 4,600 health camps all over in Hyderabad and Secunderabad cities. He has treated 6,000 plus vision therapy cases so far. So Ashoka Rehab Private Limited was established in 2015. He is one of the board of directors. There are different wings under Ashoka Rehab, namely the Ashoka Child Development Center, Corneal Dent, Ashoka Neuro Vision Clinic, Bodhi Special School. He has been recognized with honorable doctorate from the United Nations University for World Peace. Also, the center has been honored as Best Child Development Center in Telangana for dedication to providing exceptional care and support to children with special needs. Also has been acknowledged for innovative approaches and excellence in pediatric rehabilitation by the Honorable Health Minister of Telangana, Sri Harish Rao Garu. He is certified in CST, craniosacral therapy, and also in sensory integration therapy. Harshada, can we have his video, please? So thank you, Harshada. So without any further delay, let us start our session. I would like to start off with Ms. Attar. So we would like to know, are you working as a freelancer, as both an optometrist and also as an ocularist?
Yes, yes, I'm doing freelancing as an optometrist and ocularist. And in addition to my work in Soma My Clinic, I also conduct workshops, seminars, and mentorship session for the student who wants to learn ocular prosthetic as well.
Okay. So how is your work schedule like as a freelancer?
So my work schedules depend on the projects and commitments I have. So I have to plan my schedule according to that.
Okay, so you have specific days where you work as specific days that you allocate for the prosthesis consultations. How is it?
No, actually, I work from Monday to Saturday. So on that day only, I see patient as well as mentorship session, and
Okay.
it's it's like pre-planned when are the patients coming and when I'm doing the mentorship session or when I'm going for the seminars or workshop. It's like that.
Okay,
So
so you
it's in between from Monday to Saturday.
okay. You seem to be having a very good tightly packed schedules.
Yeah,
So
kind of.
moving, yeah, okay. Moving on to Mr. Likit. Taking care of an establishment which is over 50 years, how does that feel? And also, what are the responsibilities that come with it?
So first of all, it feels honored to be a part of this legacy, and also it feels that I am honoring my older generations, my father, my grandfather, etc. And about talking about the responsibilities, I need to take care of the maintaining the legacy, the reputation. Then moving forward, we also need to maintain the financial stability and all those all things come into play. Yeah.
Okay. So moving on to Dr. Kiran, very impressive and very detailed video of your rehab center. We would like to know if you had worked elsewhere, you had a work experience prior to starting your venture. So you're on mute.
Good afternoon. Great to connect with you. So I had an experience in hospital, a year, 1 year experience after bachelor's. So after that, I undergone practice in strabismus and pediatric department actually in Hyderabad only. So from that only, I inspired about this is like different field in our India. So everybody like practicing like opticals and diagnostic centers and hospitals. So I thought to why not be unique. So from that onwards only, I started my journey in this orthoptist and as a vision therapist.
Okay, so that is where your inspiration began.
Yeah.
Okay, so moving on to Ms. Attar. So,
Yeah.
what is the, do you think having a specialty qualification aids or helps in getting in more freelancing opportunities?
Yes, obviously, I think so because if you see someone who has done special qualification. Suppose I've done special qualification in prosthetic. Someone has done in cornea. Like everyone has their own field, right? So then he or she are more likely to get more attentions from the patients or doctor or opthal. Because nowadays, what I see, patients are more centralized for specialized treatment. So I think so it's very necessary to do fellowship or qualification in some specific specialty subject.
So that definitely boosts your
Yeah,
opportunity.
yeah. And I get many patients on according to that also.
Okay. So moving on to Mr. Likit, what is the wisdom that has been passed on to you by your previous generations in terms of management, business, etc.? So if you can pass on that to us also, we'll also be very glad to understand.
Yeah. So always be honest with your patients and the customers. Never give them fake promises or something. Then hard work is the key to success. You can't skip that, and there is no shortcut to that. You need to keep changing with time to time. That in terms of dispensing or cleaning, anything it may be. If you are still in the old practice, then you won't get moved for footings and etc. And also the next thing is we need to keep the quality and excellence on the top. We should not compromise in the quality that we provide.
Okay. So moving on to Dr. Kiran, from the video we understand it is a diverse child-centric center. So I think the inspiration came in from your previous work experience. So, but then other than vision, I think from the video we see many other specialities also. So can you just brief them? What are the services as a wholesome that you offer?
Not only vision therapy, so we have like so many therapies. I think we do like maximum therapies in our center. So overall, like different therapies like speech therapy, occupational therapy, sensory integration therapy, and sujok and color therapy. So overall behavioral therapy. So different counseling also we do for the pediatric cases. So there are so many issues like binocular issues, and also there are like so many other intellectual disability issues, or else like syndrome related issues, Down syndrome kind of cases. So for this, definitely they need like full-fledged concentration actually. So without concentration, they cannot improve anything. If I'm speaking right now, so definitely my movements, like the lip movement and tongue movements, right? So in pediatric cases, so they need to give proper eye contact actually. So this is like primary organ, right? So whenever we see proper expressions, emotions like a smile face or anger, so then only we capture, and then the pediatric cases, they need to going to be developed. So day by day. So like that, this vision therapy very helpful for this kind of children actually. So we work on like different issues in pediatric cases actually.
Okay, so it seems like a one-stop solution where a child comes with a spectrum of problems, everything is under one roof to be dealt with.
One.
Okay, so that's very good to hear. So moving on to Ms. Attar, what do you think are the opportunities for an ocularist, and also what are the different types of prostheses that are available now?
Actually, there are many opportunities for an ocularist. So it depends how an ocularist is going to grab the opportunities, right? So an ocularist can work in an eye hospital, cancer hospital, or in any clinic, or they can also have their own private practice where they are mainly focused on fitting and making of prosthetic. And ocularist can also be an anaplastologist where they can make silicone prosthetic for the patient who don't have for them like nose, ears, and any part of the skin, skin tags or any part of the body as well. And we can also be engaged in research and education purpose as well. So you have asked types of prosthetic, right? So there are different types of prosthetic. One is the old one, which we call ready-made eye or stock eye. Another is that is very old. Nowadays, no one uses that. And the second one is customized one, which we are doing now. So in customized prosthetic, there are again subdivided into many parts. Like we make customized conformer also for the patient who don't have eye, for the baby when we do socket expansion, and scleral shell for those who have physical eye, which in layman term we say there is no eye, right? Which slowly get dissolved by itself, or a hollow prosthetic, or iris pented conformer. So that we give in those cases where the patient has just undergone through a surgery and then they want to go back to the job or work. They can't pay it for that. So in those cases, for time being, we give iris pented conformer.
Okay, so I think you took me to my old days of prosthetic postings. So I remember seeing all these ready-made ones. I think people for patients who couldn't afford a customized prosthesis, I think these shells were an option. I did have an opportunity to show those few cells, stock shells is what they call it.
Stock eye or ready-made one. Whatever.
So thanks for the detailed explanation, Ms. Attar. So moving on to Mr. Likat Jain. So with the existing competition, being an established center, with a great legacy, do you think it is a boon or a bane?
Obviously, it is a boon for me. So it has already created a brand value and trust among the consumers over here. So, and talking about the competition, I need not worry about that because, as I already mentioned, be honest, keep working hard, and keep innovating, and also maintain your teamwork. That's the thing. So, we need not worry about that.
Okay, so it is definitely a boon then.
Yeah.
Okay. Moving on to Dr. Kiran. Can you which facility first started? Did you start your venture with such a plethora of facilities, or it is something that you started with basic therapies, and then you expanded your clinic.
So yeah, initially started we like three therapies only. So like speech and occupational and behavioral. Then slowly we started like vision therapy also. So definitely further benefits are very good for pediatric cases. So now right now we having almost 9 to 10 therapies in under one roof only. So definitely across the India, they visits like not only India, so a few like NRIs or else like foreigners also visit our nearby branches. So yeah, definitely. If pediatric cases, they're having like mental issues, right? So physical age is grown up, so mental age is very slow. So definitely we cannot like leave them like just like that, right? So for these kind of cases, definitely these all other therapies, if we are giving all together, so brain development age also grows like rapidly. So in this, definitely vision therapy is like works like very beautiful.
Mm-hmm. Okay. So moving on to Ms. Akhtar, what are the challenges do you think an ocularist faces?
Yes, being an ocularist, there are many challenges. Like in other field also, they get challenges. See, everyone has to go through challenges. So what happens sometimes some machinery issues can occur for which we need to remake the prosthetic again. And sometimes some patients come with like a very complicated socket. In those that challenge the fitting of the prosthetic, and also challenge us to give them expectation. Their expectations are quite high, but when the sockets are not good, it's being very much challenging for us to give them like 100% or 90% cosmesis. Okay. So something we have to deal with emotionally aspects of the patient who have gone through trauma and who has lost their confidence as well, and being updated with the latest technologies and method and materials, that is also challenging because we have to stay updated with all the techniques.
Okay. So convincing the patient is definitely a challenge
Yeah.
when it's a complicated case wherein the fitting might not be as good as it can be.
We cannot get every patient a good prosthetic, right? Because of
I
the
understand. Yeah.
socket complications.
I understand. Okay. So moving on to Mr. Likith. Have after you took over or working along with your father or grandfather, so as your part, have you brought in any innovation to the outlet after you joined, say in terms of marketing, operations, etc.?
So yeah, as soon as I joined, the first thing was we need to set up a clinic. Already we had a background, but we never set up the clinic as there was no certified person over here. The first thing I did was I brought the digital forever, or you first time in the Andhra Pradesh, whole Andhra Pradesh, might be a digital forever of manual one. We are the first to bring it over here. And not only that, we got the complete setup with most accurate prescription technology. Yeah, and in for dispensing also, we brought the most accurate progressive lens measurement devices and all. And yes, we keep on educating our team regarding the new latest lenses, everything, frames, etc. So we are top in that. Keep their knowledge on the top.
Okay, so a lot of
Yeah.
professional and technical inputs that you have brought in. So that is
Yeah,
very
and
good to
also
hear.
we are maintaining the records, digital
Okay,
records, so that we
very
can
good.
help in the future itself. Yeah.
Okay, that is definitely a very good step. Moving on to Dr. Kiran, so we had heard about your health camps. Can you brief us how you do it and what are the parameters that are assessed?
Okay, so yeah, in this health camps, definitely boost my energy, corneal dent. So in corneal dent, we do like eye camps and dental and hearing also. So according with that, so audiology also we do in like health camps. So mostly schools, colleges, or else like corporates or societies, apartments. So not only Hyderabad, Secunderabad, so we travel like another cities also in Telangana. So definitely awareness is required. So everyone like if I'm getting issues like hearing wise or else like visual wise, then only I visit to a doctor. So they don't know actually in pediatric cases or else like even though adults also. So if they are like feeling like blurred vision or else like I'm feeling like bit like a teeth pain, so then only yeah visits to the doctor, right? So definitely with the health camps, so they are going to know yes they having some issues, so we need to visit definitely. So like that this health camps benefit for us.
Okay, okay. So it is a multi-speciality health camp.
Yeah, yeah.
And definitely a proactive measure. As you said, unless and until we have a symptom, we don't realize that there is an issue. So
Yes.
we'll be able to pick up much before the symptom arises and treat them accordingly. Okay,
Yeah.
so moving on to Ms. Attar, so I think you had already touched the aspect of breakdowns. So wanted to understand as prosthesis, you can need it in various age groups and especially in young patients and where suddenly there is a loss of vision or a loss of the eye due to injury or whatever it is. There is definitely an emotional breakdown because they can't suddenly take it up. So how do you
Yeah.
deal with this?
So, frankly speaking, dealing breakdowns, especially in young patient or children's, it's quite difficult. We need to give them support, and sometimes they may also develop anxiety and depression. So, by providing support and counseling, help them to cope up with the situations. Okay, and by ensuring the prosthetic fits well and it's comfortable, so that they can regain the confidence back, and educating them to how to care, and educating them about the maintenance, care and hygiene, that is also beneficial, and telling them to regular follow-up so that we can monitor the size and shape, because especially in young children, what happen when they grows up, the
It
size get
changes.
changed. Yeah, so we have to keep it in monitor, and once the fitting is good, they slowly get back their confidence back by itself only. So we have to counsel them accordingly that.
Okay. So a lot of patience and perseverance is required. So how
Yeah.
often you call these young ones?
Uh, for the complicated cases, I used to call them after 3 months. If it's normal patient, then I'll call them initially for 6 months, and then they can come yearly also, either 6 months or yearly.
Okay, okay. So moving on to Mr. Likith. So we wanted to understand, do you manage the clinic alone or you have a team working under you?
So for the clinic, I am alone over here. No team for me. And yeah, when I'm done with my appointments over here, I go back to the dispensing and
Okay,
vice versa. So,
okay, okay. So moving on to Dr. Kiran. What is the level of awareness regarding visual rehabs and therapies at present? So, over the years, how has it changed? Have you observed any change?
Yeah, so true optometrist definitely has major role to creating awareness, but the symptoms should be acknowledged by on primary level like the teachers, doctors, and I mean like Anganwadis. So definitely pediatricians or else like ophthalmologists. This is like primary role actually. So overall, by birth only, definitely we see like ROP cases, right? So overall, they can help us, and also optometrists definitely through the eye camps. Definitely we will aware. Yeah.
Mm. So, the observing the child makes a lot of difference. The people surrounding the child who monitor the child will be able to pick up these behavioral changes and other changes that the child exhibits. And I think as an optometrist also visually we can pick up few things even though the parents have missed them. So moving on to Ms. Sattar. So at present, how many patients do you see for prosthesis consultation alone on an average?
Uh, Okay. So I see 12 to 20 patients in a month for prosthetic, ocular prosthetic, and 2 to 3 for orbital prosthetic. It could be more or less depending on the referrals, walk-ins, and the demands.
Okay, okay. So yours is an established prosthetic center. So I think
Yeah,
there are walk-ins also, even though it is a prosthetic.
yeah, it comes across the India, West Bengals, and from Bangladesh as well.
Okay, okay. So moving on to Likit, after starting the clinic, has it helped you in increasing the footfalls subsequently in your business?
Yeah, definitely. As already I mentioned, we started the clinic last year itself. So before that, we used to refer the patients to nearby hospitals or clinics for the refraction part. So when we used to refer, many of the places what happened was they used to convert the patients over there in their optical store. So we missed the link over there. And when we started the clinic, so we got all our patients and customers back. And yeah, in case of some complications or further investigation, we do refer to the hospitals.
Okay, okay. So clinic has definitely played a vital role in increasing the footfalls.
Yes, yes, absolutely. So they get a complete package over in a one place,
Correct.
starting from the eye checkup to the frames, etc.
Okay, and the professional help makes a lot of difference.
Yes, yes, absolutely.
So moving on to Dr. Kiran, now that you are an established rehab center, so in the initial phases, how did you manage getting patients? Mostly I think referrals play a vital role. So how did you manage referrals in your initial stages?
Yeah, now across India, definitely there are so many children. They're having like visual perceptual issues or else like nystagmus issues. So amblyopia or ASD, autism spectrum disorder, and ADHD kind of attention deficit hyperactive disorder. So another like learning disabilities, intellectual disabilities, so phoria and all. So these kind of issues definitely we need to introduce actually. So basically in schools only or else like local doctors. So definitely then only they are going to know so what issues are going on. So we cannot treat full-fledged medications or else like surgical treatments, right? So a few cases are like nystagmus, so definitely we cannot give proper surgery. So also like amblyopia cases, so definitely initially I visited so many clinics, hospitals. So then I started to hire some other persons. So definitely I trained them, and so now they are like visiting. So uh, across the cities, the now kids are coming. So definitely they are getting benefits. So, and parents also now they got full-fledged awareness through the media or else like this kind of camps, and also nowadays suggesting. Near about 100 clinics we have. I mean, like known clinics, referral clinics. So 100 plus, I think, in AP and Telangana. So they refer nowadays. So now it's like awareness is beautiful.
So I think initially that work is definitely necessary to make yourself visible
Groundwork.
and also to get the referrals. So once you establish, and then it becomes easier.
Yeah.
Getting referrals becomes easier because you're much known at present.
They know now what is what. Yeah. So and so visual issues, definitely this kind of treatment we cannot treat over here. So definitely they'll suggest to the Hyderabad, and we are going to definitely diagnosis properly, and we'll start the therapies. It takes
Okay.
time, definitely, but the treatment process is like maybe like 6 months or near about 1 year also. But results are very beautiful actually.
Okay. Okay. So moving on to Ms. Attar, so same way in your case also, how was the referrals initially? How was the referrals managed initially? Because being a super specialty, we tend to see specialized cases, and we definitely need referrals. So how does the referral system work at your clinic?
So as I attend lots of conferences, seminars, and workshops, so I have decent contacts with doctors, ophthalmologists, and oculoplastic surgeon and oncologist as well. So most of the patient got referred from them only.
Okay, okay.
And same way, like whatever the conferences get held in Bengal apart from India. I mean, so we do attend lots of conferences, and as this is a very old clinic, so many people know other also. So
Hmm.
because of the conference only, we get lots of patients.
Okay, so networking
And in Bengal, I'm the only person who is doing orbital prosthetic, which is they are doing, but what I am doing is silicone prosthetic, okay, which gets stick on the face. So
Mm-hmm.
because of that, also they are referring me.
Okay, okay. So moving on to Mr. Likith. So are you involved in community screenings? If so, how many of them have you done so far?
Yes, we are involved in community screening and also in community services. So
Hmm.
recently, I have done two community screenings. One was in collaboration with National Highway Authority on the road safety week, and the other one recently when we completed a 1 year for the clinic, then we conducted in a school for the school children.
Hmm.
So, yeah, and yeah, we keep on conducting services for like we donate for the cataract surgeries for the needy. Then we distribute free spectacles, and during the summers we distribute free sunglasses to the policemen
Hmm.
so that
Okay.
they can protect their eyes from the UV. Yeah.
Okay, okay, very good initiatives. I think Harshada, we can play a small video of his community screening.
Sure. Yeah.
Thank you, Harshada. Likith, do you give any, what do you say, any awareness talk to the children before you start? Because I see few of them speaking. Is it so?
Yeah. Many times I have done it beforehand or after I have completed the screening program. So just give them small notes on how to protect your eyes, not to use the screens and go outdoors to protect them from the myopia mainly. For that reason, yes, I do. And how to, what all to you intake and all.
Okay, okay.
Those
I
things
think,
yeah.
yeah, I think we'll share with you the OCA videos also, which talks about awareness. So it is made child friendly, wherein the cartoon, in the form of cartoon, the information is passed across. I think you can use those
Yeah,
in.
already I am using those videos on my WhatsApp and all
Haha,
for
I
the
think
patients, and I
when you,
keep sharing those.
I think with the school's permission, probably you can project them also, so that makes it
Yes,
interesting
yes.
for the kids, so that their attention is much better than we vocally speak.
Yeah.
So moving on to Dr. Kiran, so we see your psychology background. So this you started pursuing it later. You started your rehab center.
Yeah, so initially, definitely, as we know, psychology helps to read mind and understanding the person mindset, right? So definitely people are coming with the issues. So like how they are, like children also definitely. So kind of depression or anxiety or fear complex. So they cannot see properly. They cannot give eye contact properly. So we need to understand their emotions actually. So definitely, if we are going to understand their emotions, then only they are allowed to touch you. So like if you're doing any examination, eye examination or like any other therapy, so we need to diagnosis first of all. So we should be comfortable with them. So that's the reason, yeah. So psychology, it's a basic subject. So not only optometrist, so any one can study about psychology. So that helps you to grow more. So people are coming further. Like example, we are in optical. So if you are like coming for basic sunglasses or basic spectacles, so depends upon that client. We need to advise them. So that mindset we need to understand. So there's a reason I planned for this psychology after rehabilitation.
Okay, okay. So I think even counseling aspects help, because I think parents, when diagnosed with special children, definitely break down. I think the acceptance is the key for the next step. So without acceptance, I don't think so a therapy helps. First
Yes.
is acceptance. You accept that you have, and then you march forward and then get it better done.
Mm.
Okay, so moving on to Ms. Attar. In case an optometrist wants to learn and specialize and start his ocularist practice, what is the advice that you can give in terms of setup and referrals per se?
I'll say it's a good career option, but it's a bit risky also, because everything is challenging. So when it's come to prosthetic, so they have some basic knowledge about the prosthetic or the plastic department. Like there are many terms, many diseases, and many theoretical parts is there. So if they have knowledge or experience, they can go ahead. But if they don't have knowledge or experience, then it will be quite difficult. So I advise optums to go for higher education or fellowship in ocular prosthetic. That long-term fellowship will be good option if they wanted to start or they wanted to learn. So long-term fellowship will be good option. But especially for our girls, it's look good from outside, but when you come and doing work, things, so if you see patient, that part is okay. Suppose if you're having your own clinic setup, you're not going to keep lots of staff now for the lab part, right? So initially you have to do everything on your own. Once it gets better or you are fully established, then you can keep many staff. So that is a one weak point which we can say. Because what happen if you do lab work in front of the patient, some patient can say, oh, she is a technician, she's not optometrist or ocularist. That part is not good. I don't feel good as an optometrist or ocularist. That part is like, I don't feel good. So one should have their lab separately, so that patient cannot see over there. But slowly you will enjoy the work what you are doing. See, we are not saving someone's life or vision, but what we are doing is like, we are giving their confidence back. Many times what we have done is like, what I have done, like I've made a prosthetic which no one is able to understand that they're wearing an artificial eye. Sometimes they got married also without telling their husband or in-laws that they are wearing a prosthetic eye. So sometimes it's so good that no one is able to understand whether it's wearing prosthetic. So every field has good and bad. So I have told both good and bad parts. So it's up to the optums how interested they are.
So I think nowadays, I think you were talking about these silicon prostheses.
Yeah.
As such, I'm not updated about prostheses, but then at least when I was in my internship, you have these machines which cut the prosthetic eye to shape it and then fix it if if it doesn't fix properly, if it is big or small, I mean, if it is too big for the patient, or if it is uncomfortable or poking or whatever it is. So they used to smoothen the edges or cut those edges to make it fit, make the fit proper. So you think that is what you mean by workroom? Even the silicon processes need such things?
No, actually silicone is very soft and fragile.
So,
If you're
yeah.
going to cut, that is not going to happen. So I guess you're talking about the ready-made one or stock eye. Earlier, what they used to do, they just put one approx size and put on the eye socket. So if it doesn't match, then what they used to do, they used to cut the edges or make it cut from up or down to make it hyper, iso or exo,
Correct.
so that it gets fits. But nowadays we do in that way, but not exactly in that way. There are
So in terms of
very
silicon, what
latest
is the
technology.
workroom that you're talking
Acha,
about?
silicone we use only for orbital prosthetic.
Okay,
So
not okay.
I have that video.
Yeah. I will play this
saw.
after.
Yeah, so this in the
We have
previous
played.
video,
We have played it.
you
Yeah,
saw
yeah.
you saw na, that the thing which I was mixing it, that is silicone, which will look like skin. So we will put the color to match the tint of the skin of the face or eyebrow, or I mean eyelid, to match the skin. So silicone is very fragile and soft. It's like a skin. It's not hard. So we won't provide ocular prosthetic in silicone based. We
Okay,
provide
okay.
only for the orbital or facial purpose.
Okay. Understood. So moving on to Mr. Likith, so why do you think as an optometrist getting involved into community screenings are important? And also, does it have an impact on your business as well?
So yeah, as already Dr. Kiran sir, he already mentioned that it creates the awareness, and also it helps the people who can't afford the treatment. Basically, we can at least we can screen those patients, and we can provide them the service that is required by them. And regarding the business, it doesn't affect, but it promotes my business, as it creates a trust that yeah, my health is in a good hand. They can look after me, and so on. And the business keeps increasing. I screen a patient, he refers to another patient that you can go over here, and it continues in a chain. Yeah.
Okay. So moving on to Dr. Kiran, so you have a diverse set of therapies and treatment plans for children. So as an optometrist, what is the role that they play in the clinic, in your clinic?
Okay. First of all, definitely, as a vision therapist, we need more patience. So we can work like it's like we need like passion. So definitely, patients are very different types of patient visits. Like they have like behavioral issues, or else like they are very silent, hyper we say. So for that kind of kids, if you are going to manage, so we need a patience. So patience makes perfection actually in this field. So we have to handle each and every moment actually. So they cannot see this side, that side. Okay, so we need to focus on like we do like this brook staying and all. So RF ruler, but converge and diverge. So we maintain like full-fledged eye contact. So definitely in future, very vast demand we have for optometrists.
Okay. So definitely a specialization which we can think of pursuing with the demand that is there at present. So moving on to Ms. Sattar, so what is the average number of hours and the sittings that are required to finish one fitting?
To make one ocular prosthetic, it takes 6 to 8 hours. So it depends upon the complexity of the case. From starting consultation to final fitting, it takes 4 to 6 sittings, and each sitting lasts for 1 to 2 hours. Suppose we are taking impression of the patient eye, it takes 45 minutes to 1 hour. Again, it's depend on the complexity of the case. And then again, we are making mold and then sterilization procedure. All these are different procedures which takes 3 to 6 or 4 to 6 sittings, which all take 1 to 2 hours. Each sitting takes 1 to 2 hours. So
Okay.
overall, it takes 6 to 8 hours to complete one prosthetic.
Okay. So moving on to, I think, Harshita, I think we can play the video. That is definitely an impressive work, Ms. Attar.
So last 3 photos which you have seen, those are silicone based, which
Okay.
gets stick with the face. You
Uh-huh.
saw the hollow part, right?
Correct,
That is
correct.
made up of silicone.
Okay. So moving on to Mr. Likit, so what are your future plans for the clinic? Do you have any branches or you have plans of expansion?
So yeah, present for the clinic, I would like to provide more specialties, vision therapy, specialty contact lenses. This is the future plan for the clinic. And for the dispensing, yes, soon we are going to expand with another branch over here.
Okay, so that is good to hear. Wishing you an all success.
Yeah,
So
thank you.
moving on to Dr. Kiran, with the existing clinic, if an optometrist inclines to start a vision therapy practice, so how should one go about it? How should one start with it? Say basically in the beginning, so later on probably they can expand. So what are the bare requirements that an optometrist should have to start a vision therapy practice?
So regularly, we do like regular vision therapy. So accommodation issues or else like convergence, insufficiency or excess. So this is like a regular vision therapy we practice in India. So with that, we do like strabismus cases also, like basic, I mean like tropia cases also, like 8 prism or 9 prism, till 10 prism. Definitely there are so many improvements cases we have. And also Fourier cases, we cannot do surgeries, right? So this
Correct.
kind of cases also we do proper vision therapy. So this comes under completely strabismus vision therapy, and also behavioral vision therapy. So this is like a vast organization actually. So definitely there are so many patients we required, and also not only vision therapy. With the vision therapy, we need different kind of therapies with this behavior vision therapy. So of course, if we having like a hospital or else like optical. So we can start with the strabismus and regular AI and CI cases. So we need like regular probe string that comes small equipments. So,
Correct.
but proper knowledge we required after bachelor's or master's. We can go through the proper strabismus cases and orthoptic subject. So then only we can start vision therapy. Otherwise, this may be going to be like a reverse. So patients going to definitely they feel like headache and all. So doubling vision also they may feel. So if you're planning to start, definitely we need like small instruments and proper knowledge. Then we can start.
Okay, so you recommend to specialize and then start the clinic with basic tests and the therapies. So moving on to Ms. Attar. So over the years, I think you would have definitely helped a lot of patients. So can you share one or two cases with us where you think as an optometrist or an ocularist, you made a huge difference to their life?
Yeah, actually, I have lots of cases, but I have one memorable case because that was just starting of my career. So one girl, she was a very young girl, 20-year-old girl. She was accused with acid injury, okay, acid attack. So she came to my clinic. She was accompanied by her parents, and she lost her confidence and everything. Her face was completely burned. One side was completely gone. Nose was also tilted. Her bone was also fractured. So in her case, I have made orbital prosthetic, which is called silicone prosthetic as well. So after seeing that, she was very happy. Her confidence was again, she gained her confidence back. Okay. And then after 6 months of her follow up, she came back to my clinic and she said that she's going to get married in 10 or 15 days. So she was really happy. After that, she got her everything normal. So I think so that one was a very memorable case, and that was very initial of my career. I just started my career at that time.
Okay, okay. Very good to hear that. So, Likith, after the clinic, I am sure that you are getting to see a lot of patients of various age groups. Do you think can you share any case wherein you made a difference? You feel that you definitely changed
Yeah.
where.
Yeah. So one of the cases, the most common case that I get is of pseudomyopia,
Mhm.
and the other thing is for pediatric. So where we are located, there are around 50 to 60 outlets, optical stores in just a radius of 1 kilometer. And the number of qualified optometrists, that is bachelors, there are only 4 to 5, including me. The rest all also provide the eye checkup and everything, but they don't know the back end story. So to whom we should give the power, who is a myope, who is a pseudo myope, how to give a proper prescription to the children, cycloplegic refractions and all. So they don't know about that. And yeah, many cases children were given -3, -4, these kind of powers. And when I have done the cycloplegic refraction, it was just around -1 spherical, -1.5. That was a large difference, big difference when, yeah.
Okay, okay. So moving on to Dr. Kiran, I think with your vast experience, I'm sure you would have touched many lives positively. So can you share any one or two cases wherein?
Yes.
Yeah, so one of the case from North India, from UP, I
Actually,
think.
your voice is breaking.
Yeah. So they visited to our clinic. It's been like 1.5 years back, I think. Child age is like 7 months. So they visited so many hospitals, even the stroke hospitals also. So they referred to LV Prasad. The child case is like macular fold. So the here is like few doctors said like there's like we cannot do anything for this child visual wise. So however, if you're going with the low vision and all, so definitely it may be helpful for him. So they came across like the South India hospitals also. Now this I mean like 1.5 years back, I think they started vision therapy. So child is now identifying full-fledged faces. So he's like writing skills and doing activities. Right now his age is like 2 years, I think. So full-fledged normal. I mean like vision is like with the Lia chart we observed 6/18 vision is there. So that's one of the success story. So child parents both are like doctors actually. So they gave initiative like almost 1.5 years. So his mother is stopped her practice. So she is still with us only. I mean like a rehab center. So she visits daily for vision therapy. So also color vision case. He visited almost other countries also. So and he came to our Cornell Den. So I don't have proper. I mean, like I didn't send you about that case. So overall, right now he is accepting all the colors. Color identification is good now. So I gave like red and green filter glasses only. So it depends upon tint. So he accepted full-fledged. Now he's rectifying full color vision. So that one also a good success story.
Okay. So nice to hear all of your success stories. I think we definitely had a very inspiring session, and we had panelists from different backgrounds, and I think definitely we would have given a lot of insights through the session. And I would like to conclude this session with apologies. I am sure that all your appointments are there. And then sorry for the delay from our end. Thank you. Thank you for accepting the invite and being a part of the session. Thank you very much.
Thank you, Spandana, for
Thank you.
giving us the opportunity.
Thank you.
Thank you. Thank you so much.
Yeah.